Secondary traumatic stress is something that happens to foster, adoptive, and kin caregivers who are working with children who've experienced complex developmental trauma. And what happens is, because of the exposure to the child's trauma, it actually creates a traumatic reaction in the caregiver. And this exposure can come from a number of ways. It can come from hearing what your child says and what they say about their experience. It can come from observing your child's play, or their drawings, or things that they write. It can come from witnessing your child reacting to the trauma. So if they get really upset and have a really hard time, witnessing that can create its own traumatic reaction in you. And finally, some cases there is a lot of media coverage, so you might see that. You might go to court and hear things, reading case reports. That kind of exposure can also happen. This exposure can cause you to have intrusive images, nightmares, nervousness or jumpiness, an exaggerated startle response, and sometimes emotional numbing. For some caregivers, they find that this exposure actually changes their worldview and they start to feel more negatively about life and the world. They might have feelings of hopelessness or helplessness. They might have feelings of extreme anger or feeling really disconnected from people that they love. They may lose perspective and identify too closely with their child, or the opposite, they might find themselves pulling away from their child and separating from their child. You might have difficulty differentiating between your child's experience and your own experience. You might have expectations that your child is going to cope in the same way that you did. So if you find yourself experiencing secondary traumatization, here are some things that you can consider. First, recognize the connection between your child's trauma and your own history. Second, distinguish which feelings belong to the present and which feelings belong to the past. Third, be honest with yourself, your child, your caseworker. I'm not saying you tell your child the nitty-gritty details of what may have happened to you, but sharing with your child that you had a similar experience, or sharing with your child how you're struggling with some things, is a fine thing to share with a child. 4, get support, including trauma-focused treatment for yourself. It might include going into individual therapy or couples therapy or family therapy. It's never too late to heal. And 5, recognize that what worked for you may or may not work for your child.